Are you pregnant or a new parent looking to ensure a better postpartum experience? Or are you a birth worker looking to improve your postpartum care skills? Check out Thriving After Birth, an online self-paced course by me, midwife and educator Tanya Tringali. It's 10 and a half hours of video content featuring experts in lactation, mental health, pelvic floor health, pediatric sleep issues. You also get worksheets and a workbook, as well as options to have a one-on-one session with me. Sign up at motherwitmaternity.com/thriving, and let's improve postpartum care together. Welcome to episode number 9 of the Mother Wit podcast. A gentle reminder that nothing we discuss on this show should ever be considered medical advice. Please speak to your local provider about anything that comes up in this show that resonates with you and your needs and your health care. My guest today is Erin Khan. She's another one of my pandemic mamas. Her baby Silas is 19 months old now. She and her husband Jeff have had a lot on their plates. They are sandwiched between caring for a baby and elderly family members. And although this has become more common in American households, it's not exactly common for families that are young and just starting to have children. It's much more common in families with at least teenagers, if not adult children. When I was working with them, they were in the thick of caring for Jeff's elderly and disabled parents. His father has since passed away. So they were dealing with this in addition to a new baby and the pandemic. Much of Erin's postpartum journey was colored by ongoing struggles with tongue tie. Interestingly, though, she's a speech-language pathologist herself. However, she doesn't work with babies. She works largely with adults and people who have neurological problems, not babies. But the point is, she knows good therapy when she sees it. She knows bad therapy when she sees it. And one of the biggest challenges with tongue tie for her, in addition to a really rocky start with breastfeeding, was trying to find answers and the right help. We're also going to discuss other struggles that she faced, including trouble with perineal healing, postpartum depression, and her personal experience of trying to sleep train her baby. Erin, thank you so much for joining me today.
It's so good to see your face again.
It's so good to see you too. Like, just for our listeners' sake, Erin and I have not seen each other's faces for what I imagine is 16 months, at least like real life faces.
Yep. It's been a while.
So, we really haven't caught up in any major way until very recently in preparation for this podcast. I think we've touched base just a couple of times over the past pushing year and a half at this point. So I'm really looking forward to hearing a lot of your updates, in addition to hearing you recap some of the things that I know happened. But I think you've got a lot of distance now from some of those early experiences. And I think that that's really valuable for our listeners who are either still pregnant or really in the early postpartum period themselves.
Definitely. Distance and reflection and time to really digest it all and digest it in therapy has been helpful. So the time and distance has definitely helped gain some perspective.
That's awesome. So, okay, let's start from the beginning. Can you kind of take us back to what was going on for you around the time that you decided that it would be wise to invest in some postpartum support?
So that takes us back to the beginning of the pandemic. So I was sitting at work. I opened up CNN's homepage, and the whole screen was the World Health Organization declares coronavirus a pandemic. And my husband and I have been talking about this thing emerging. And basically, I packed up my office. I went home and did not go back to work. Because I was in my 3rd trimester, and I work in a hospital, and I work with high-risk patients, high-risk situations that I didn't want to be exposed to in my 3rd trimester. So ultimately, I went out on disability and did not return to work, which was really awful. It was not the way that I wanted to leave my job. I loved my job. I'm a speech language pathologist. I do work in a hospital setting. So that was it. So when that happened and the world was shutting down and everyone was scrambling to deal with this new thing and people were scared and uncertain and making decisions that everybody was doing their best, but we didn't know how to fight this thing. My hospital tour was canceled. All my pre-birth classes were canceled. And I was left at home scrambling with the rest of the world. And it was a really scary, scary time. So my mindset was, okay, well, I'm stuck at home. I'm now in this quarantined bubble. The world is shut down. What can I do to prepare myself? What can I do? How can I'm a type A light kind of person. And the way that I keep my anxieties at bay is to really feel prepared and to really lean into organization and learning as much as I can about something so that I feel prepared to tackle it. Which is kind of a funny thing that I'm also working on in therapy, but that's a whole nother story. So I did everything in my power to really learn what I could in preparation to be a new parent in a totally new and scary world without any support. It was really hard, and it was harder than I imagined and harder than I was prepared for. And even though I had done all the research, I had read all the books, I had listened to all the podcasts, I'd followed all the Instagram accounts, I had Tanya in my back pocket, it was hard. We struggled.
You had a hard road, right? So, one of the things I talk to people about often when I'm getting them settled in the program is that there are X number of problems one could encounter, right? I don't know what that number is even, right? But there's some number of problems that can be encountered. And I usually explain to people that most people on average encounter about 3 speed bumps, but I don't know which 3 they're going to hit. I just know that from doing this work for as long as I've been doing it now, that's about what we see. Some people 2, some people 4, an outlier 1, an outlier 5. Maybe a miracle happens and someone has 0. I'm not sure I've actually seen that. But you had, I mean, just today alone, we're going to talk about 4 very particular things, not to mention life circumstances that we could call another thing. And that's a lot. That's a lot.
Yeah, no, definitely. And it was, I think it was particularly challenging because to toot my own horn, I've been rather successful in my life. I have a successful career. I had a really great marriage. I have a supportive family. And all of those things took a hit. And that was hard. And then put on top of that, sleep deprivation, no breaks, because my husband, we own a small business and he runs the small business. So he was trying to navigate being a small business owner in a pandemic and how to take care of his employees. And he had that going on in addition to, as you mentioned in the intro, taking care of his elderly and disabled parents. Just to give some context there, they live about a mile from us in a condo. We had a caregiver coming in every day. She ended up actually moving away when my son was about 2 months old. So we lost our caregiver for them too. So it was a lot.
Yeah.
And looking back on it and really, like you said, kind of having that distance and time to think about it. I always hated that phrase, give yourself grace, because I didn't know what it meant. Now that I have some time and distance and therapy and really working to process and actually grieve that time in my life, that phrase has brought on, has really come to mean something different to me and to be meaningful, to give myself grace about how hard that was and how we were all just doing our best. Um, and our best was good enough, even though it didn't feel like it at the time.
Wow. Oh my gosh, Erin, you're giving me these like goose pimples all over my body because I remember watching you go through all of this, and I remember really feeling for you guys in a way that is different than many of the other people I have felt for, because I could, it was palpable how much you guys had on your plate, and you were fighting so hard to get through some of these things. And I mean, even with what I think you agree with, good help all around you, it was still just a real struggle.
Mhm.
So, can you tell us a little bit about those early days breastfeeding and how it came to be, how it unfolded, the tongue tie diagnosis, and how you worked through that?
What a nightmare. It was awful. I will say that we got through it eventually. Silas has been exclusively breastfed since day one. He still breastfeeds. He's 19 months old. Um, he does, when he wakes up in the morning and to go to bed at night and occasionally during the day. So we got through it. We have a great, beautiful breastfeeding relationship, but it took a long road to get there. So he got the tongue tie diagnosis actually on day one. We saw a lactation consultant in the hospital. The first one we saw came in, she checked out his mouth, she made sure everything was looking good, and she said, "Oh, I think he has a tongue tie. I really think you ought to make an appointment with either an ENT or a pediatric dentist." And this is like 5 hours after he's born. I'm like, wait, what? What is happening? Why do I need to see these people? Don't you know there's a pandemic, lady? Like, we're not leaving the house. Uh, we talked to the OB who came in afterwards, and she was a little bit more loosey goosey about it. She's like, you'll be fine. Some people have trouble, some people don't. Don't worry about it. We were in the camp of having a lot of trouble. So anytime he latched, it was incredibly painful. I had really sore, cracked, bleeding nipples for the first 4 months. It was awful. There were a lot of tears shed over breastfeeding, a lot of not feeling like I was failing because I knew it wasn't my fault. I could look at it with objectivity and saying like, this is something anatomical. This is not Erin's fault. But I felt it was so hard to find the right help, and that's where I started feeling like a failure.
And
So that it was hard.
when you say find the right help, I want you to go back one more time, because you got this diagnosis on day one, and I totally get that, like, because of the pandemic you were feeling like we didn't want to go out and deal with this. So what I'm wondering is if part of the delay was specifically about not wanting to go out and go to doctor's appointments, or if you legit had a hard time finding a provider who would see you, and secondarily, was that related to the pandemic or lack of access in your area? Can you just elaborate on that piece?
Yep, absolutely. So after a couple of days and breastfeeding was still a challenge, we did make an appointment with an ENT. We literally went to the proverbial phone book, went to Google and tried to make an appointment with any ENT who would see us. Most people were not taking new patients and would not see us because we had been in the hospital. So it was pandemic related that we couldn't get an appointment. We also knew nothing at the time. I've since learned a whole lot more about tongue tie, and do not recommend that you just Google it because that's not the way to do it. We did end up seeing an ENT who told me, snip, snip, done, no big deal. We'll do this quick clip. You're good. You'll be good to go. He was very wrong. So we did that when Silas was 5 days old. And so we went in, he did a procedure where he clipped the thin flap of skin underneath the tongue, essentially with scissors. It was horrible. Silas turned the color purple. it was traumatic, but I kept thinking in my head, this is the right thing to do, right? Someone told me that this was a problem. We're having trouble breastfeeding. Like this is going to solve the problem. It was hard not to feel guilty putting him through that. And then ultimately it didn't solve the problem. And the more I learned about, okay.
Sorry, was there any change at all?
There was, initially, so he breastfed in the office right after the procedure, and it was improved. I didn't, my toes didn't curl and I didn't just completely seize up in pain. So it was slightly better, but that didn't last. So then I'm thinking, all right, well, this guy said snip, snip, done. Maybe it just needs to heal. Fast forward 2 weeks, and I've gone down the Instagram rabbit hole. So Instagram has been kind of a double-edged sword for me, and I think is this way for a lot of people. As someone who's not really into social media for the most part, like I don't have Facebook. I only use Instagram with my, 20 close-ish friends and family. Very small social media footprint. Instagram became this mammoth of information, sometimes misinformation, sometimes too much information, but it also became a gateway for me to start learning about tongue tie and later on learning about postpartum depression. So with the tongue tie, I eventually hooked up with a speech language pathologist who worked with pediatrics. On her website specifically says that she works with tongue tie. To get to see her, that took many emails, but I'll try to keep it all condensed. We saw her a couple times, and I left her office one day and just thought, I hope my patients never feel like this after a session with me. Just like, what did we just do for the last hour? Well, did she help? Like, what is this?
Can you give me an example of something that was a little bit off?
I appreciate when a therapist says they might not know as much about something or they want to consult with their colleagues. I appreciate that. That's great. It's great to admit what you don't know. It's not a fake it till you make it situation. This felt like she was like going back to her college textbooks during our session and kind of telling me things to do in his mouth that I just felt like there's no possible way that there is actual evidence that this improves the problem. So I just kind of had a yucky feeling after a couple times seeing her. On top of that, therapy skills aside, there was some questionable PPE use. Like she kept taking her mask off during the sessions, and that made me uncomfortable. So I ended up basically breaking up with her. And then I felt like back to square one, like, what do I do now? Who do I turn to? I already called every speech language pathologist in our area. The only good that came out of her was in her evaluation, she did say, hey, I don't think that the ENT, the ear, nose, and throat doctor, clipped the tongue completely. I still feel a bump here. I think he's still restricted. So she did recommend that we go see a pediatric dentist who ended up being wonderful. And he did sinuses surgery again, this time with a laser. It was such a better experience than the first time with the ENT. Silas cried, but nothing like that first time. And because it's with a laser, it was much more precise versus like scissors. It was just a completely different experience. So we did see him towards the end of June. Silas is about a month old at this point. And this pediatric dentist also talked about, it's not just snip, snip, done. There's a lot that can come along with this. You might get it, you might not. Turns out we kind of hit it all. But it was helpful to like have somebody who who I felt like they were actually knowledgeable. He knew what he was doing. He worked with tongue tie. He had done this procedure, some thousands of times. That was finally kind of a win in our book. And he was able to recommend a speech language pathologist who we ultimately ended up working with for the next several months. On top of that, so I mentioned that we kind of had everything that comes along with tongue tie. So Silas had something called torticollis, which is basically a tightening on one side of the body. And it could be from the tongue tie. It might not be from the tongue tie. It might be from how he was positioned inside of me. It might be how he was positioned during labor. It could have come from any number of things. It could have be related that he had reflux, and I didn't really know because everything I read said babies spit up, they're fine, right?
Could you see the torticollis yourself?
Eventually. So what clued me into it was I was looking through my phone and my picture gallery, and you take 1,000 pictures of your baby, and in every single picture he was in the exact same position, where his body was curved to one side and his head was tilted to the other, and in this funny S shape in every single picture. It's like, that's not right.
You are not my first client to figure that out in a similar way, which is really interesting. So now I have a virtual health strategy to help people look for that because of you.
Yeah. And at this point, because I had been kind of down this tongue tie road and looking at all these Instagram accounts that talk about tongue tie a lot, I'd seen torticollis pop up. So I knew it existed. So he ended up having weakness and tightness on that left side. And it actually still affects him somewhat today. When he walks and runs, his left side is still it's a little funky. And we still kind of do therapy exercises for it at home. So, okay, I got the tongue tie fixed, right? More on that. I got a good speech therapist. Love her. She's great. Okay, great. But now this torticollis thing. Oh, okay. All right, how do I find a physical therapist to work with my infant who is virtual, who's knowledgeable? It seemed a really heavy task. Oh, also everything was shut down, right? So it was hard. And meanwhile, I'm wondering, what is wrong with my baby? Is there something that I can do? Is there something that I did? And then on top, don't sleep, right? So it was a lot. And again, we didn't really have any support. Jeff was running a business. My parents were not really very helpful at all. And then Jeff's parents are disabled, so zero childcare. Eventually, we finally got with a physical therapist that I felt was helpful. It took 3 therapists to get there, 3 or 4. And even her, we saw her for several months. I felt like we're really not making any progress. He's just growing up. And I ended up kind of breaking up with her too. So,
question. So now after the second attempt at the revision for the tongue tie, the one that was laser, that was gentler and everything went better, was there progress there? Because I'm hearing you say we were kind of status quo, and obviously my memories are fading from my time working with you, but I'm really wondering if it really was truly status quo, and if so, how in the world did you not quit breastfeeding?
I have no idea how I didn't quit. And, a big part of my reflection on that is I wish I had. It would have been better for my mental health. But I kept hearing, breast milk is gold, give him antibodies, blah, blah, blah. And I had formula in a closet in in case of an emergency, if something were to happen. And it felt wrong to turn to that. It felt like I shouldn't do that. Formula is I'm going to say this and truly know that I do not mean it. Formula is bad. In hindsight, oh my gosh, that's insane.
Okay, here's another question for you. What about the middle ground of pumping and giving breast milk that way?
Right? That would have been great.
Did we not
Um,
talk about that? I mean, I'm
we
looking back
we
going, did I
did.
not talk about that?
No, I'm sure we did. So with the tongue tie, just because um so even with the bottle would be hard. So there it was more complicated than that, right? So even if he was taking a bottle, like it was still a challenge. Um, and what really got us through the tongue tie was that I was an oversupplier. So I had a hard and fast letdown. He did not have to do very much work. And my breasts were basically like, here you go.
Mhm.
And that's what carried us through.
And
Um,
so it sounds to me like, well, I'm guessing based on everything you're saying, because at this point I really don't remember the details as clearly.
mhm.
I'm guessing that at some point you thought, if I have to sit here and be attached to a pump and then feed my baby with a bottle
Yes,
and it's still difficult, I'd rather just breastfeed.
absolutely. Um, yeah, absolutely. And then there's the cleaning the pump parts. There's finding the time to pump while you're attached to a newborn. Um, and my husband, Jeff, is wonderful, as helpful as he can be, but it was on me. So yeah, I did pump a little bit, maybe when Silas was about 3 months old, um, because someone told me that it's helpful if the dad gives a bottle. So plenty of other ways dad can bond with the baby. Um, so we did do bottles a little bit, but then it was easier to breastfeed. And at that point, breastfeeding wasn't super painful. I was using a cream that had been recommended by a lactation consultant. And along this whole road, I worked with 7 lactation consultants until I finally found one who truly understood and was absolutely helpful. And I have since seen her once when I had a questionable mastitis, and she was amazing and helpful then too. But in the meantime, 7 um, took a
Wow.
while. Yeah,
Wow.
some people were helpful, and some were detrimental. Ultimately, in hindsight, looking back at some of the things that they talked to me and they dismissed, and they were actually kind of detrimental to the whole best breastfeeding journey. So at this point, kind of to answer your question, yes, things were kind of status quo. Um, Breastfeeding was possible. It was still a little painful, but it was okay. But I couldn't wean off the cream that I was using on my nipples. Um, I don't know how much you want to go into like medical stuff, but it's called apno cream.
Yeah, I can explain also to our listeners, this cream is something that a lot of like OBGYNs maybe haven't heard of, or maybe others have heard of it and they kind of don't actually think it's worthwhile, and maybe some others are out there and think that it's fantastic. But APNO, APNO, stands for all-purpose nipple ointment, and it's actually something that you have to get from a special pharmacy, from a compounding pharmacy. You can't. It's not just sold in a tube in the regular old CVS or whatever. We actually have to write a prescription where we detail out what the items in it are, and it basically is this sort of wonder drug of a topical medication because it has antibacterial properties in it, it has antifungal properties in it, it has a steroid in it so that it starts to really clear up and let you heal. But the thing is, anything that has a steroid in it, you're not supposed to use kind of ongoing. And I think where Erin's headed with this is she was kind of addicted to it.
Pretty much. And I was aware of that this was not a long-term solution. So I was trying to use it as sparingly as possible, but I still could, like, if I went more than a day without it, my nipples started cracking and bleeding and being in pain again. So this is the end of August at this point. We're working with a speech therapist who's knowledgeable, she's helpful. Um, Everything's virtual. So she's not actually seeing inside Silas's mouth. She's not seeing me breastfeed. She can't feel it. She's doing videos, which are good, but in some ways a little limiting. So we finally went to see her in person And I had kind of had this hunch, like maybe the tie is still not quite all the way cut. Like, what do we do? I can't believe I'd go back for a third time. Would I put Silas through that? Is this tolerable for me? He's going to start solids in the somewhat near future. Am I even going to continue breastfeeding? All these questions. And what we ultimately ended up doing, and this was a decision that was made after a lot of discussion with his speech language pathologist and with the pediatric dentist that we worked with. Everybody kind of weighed the pros and cons. It felt very much like a team discussion, that there was no necessarily crystal clear right answer, but we ultimately did a third revision. So first the ENT, that was horrible. The second time was with Dr. Ryan, the pediatric dentist, in June, and then the third time on October 1st. That night, I regretted everything. The next day, everything was great, and we have been smooth sailing ever since. Tongue tie stuff was behind us.
So what you're telling me is that his tongue tie was so extensive that it just needed to be done at a deeper level than it sounds like people are typically used to doing it?
Exactly. And I had a lot of concerns about doing it 3 times. I had never really heard of anybody doing it like that. And I'm going to just really say that it was done twice, because the first time, I'm just not even counting that. The guy did a botched job. So really the two times with a laser done by somebody who knew what they were doing. Yeah, it was surprising and scary to make that decision. I had a lot of fears about it, and ultimately it worked out. So after October 1st, 2020, it's been completely smooth sailing. I did email that very first lactation consultant in the hospital. I emailed her around that, and I just said, thank you for finding this, for giving me at least a launching pad to advocate for my son and for myself, and to know that something is wrong and we need to fix it. Now, that journey was hard, right? It was hard to find the right people. It was hard to find the right information. But we did it. Eventually, we did it. And I did have a lot of pride in that. I felt proud of myself for advocating for him, for advocating for myself, and knowing when to say no to a healthcare professional, like this therapist that I said we ended up not working with. That's hard, but I really trusted my gut. I trusted my clinical experience to say, I don't really think you're worth it.
So, it's interesting for our listeners that are not healthcare professionals, which is probably the majority. It makes me wonder how much harder it is for someone who doesn't interface with the medical profession every day. You had a leg to stand on as a medical professional, to trust your gut and say, I know right from wrong. But
Absolutely.
it just breaks my heart every day. Like, this is not supposed to be the way it's supposed to be.
Yep.
Ay. Okay.
And I knew the right questions to ask during the sessions. So I'd come in with my list of questions, and they're clinical questions. And if the therapist wasn't knowledgeable on those, then I wasn't gonna proceed with them. So it was tricky, and I was picky. I was picky about who treated my son, because I wanted the person who was actually going to help him. And it's okay to be picky. It's okay to say that this person isn't a good fit, which is hard for me as a people pleaser and someone who's, non-confrontational in any way. It was hard. But I did feel empowered, and I journaled throughout all of this. Journaling is something that I've always really enjoyed doing. And I remember writing specifically, like, I'm really proud of myself. This is hard, and I feel like this was kind of my first test as a new parent, and I kicked its ass. So that was, amidst all of this stuff that was really challenging every single day and every single night, all night long. it was nice to feel that pride and that empowerment.
Yeah. Wow. What a story. And I mean, that's only 1/4 of what I wanted to talk about today. I don't think the other three parts are quite as in depth, but I totally want to hit on them. And I want to hit on, if you don't mind, the postpartum depression part last, because I just think painting all the picture of all the things,
Hmm.
will help make sense out of where you landed when I think you took a breath and that's what happened. But anyway, I'm not going to overdiagnose you here.
We hope you're enjoying the Mother Wit podcast. If you are, please rate us and leave a review in iTunes, Spotify, or wherever you're listening to your podcast. Thanks so much. Now, back to the show.
Okay, let's talk briefly, because I remember this part more. This is where you and I spent more time working together. I feel like what was going on here and why my memory is feeling a little out of sorts is because, we kind of took on the model, I think, of you're caring for your baby and it's all very intense and I'm caring for you, right? Like it was kind of a cycle of like, let me take care of mom while mom is taking care of baby, because the baby stuff was so far outside of my scope of practice working with you as a virtual midwife, right? So when I would ask you to focus on you and your health and we would get around to your physical health, you kind of had this chronic ongoing nagging complaint about your perineal healing from your tear at birth. Can you tell us a little bit about that?
Yep, absolutely. So um, bef- to set the stage for that, so my OB practice, they also had they had OBs and they had midwives, and it was through a large university practice. So I never really saw the same person more than once or twice. The person who ultimately delivered Silas, like I've never met her in my life. Um, and I know there's some value to that. In hindsight, I would do it differently. Um, but it all felt very anonymous. Um, and I think it made it challenging, trying to figure out the right words. As I was going through with Silas's tongue tie and experiencing disappointment and almost a mistrust of providers, it then also going through my own healing and working with the OBs specifically, and not healing and not healing and keep going back and keep going back, it kind of fed into that disappointment and that mistrust that kind of festered really, and something that I've been working through in therapy now. So what happened was when I gave birth, I did have an epidural. I had a tear. I had a grade 3B tear, I think, 3A or B. So what that means is that I tore from my vagina all the way through my rectum, or halfway through my rectum.
So
Um,
you didn't go all the way through
right.
the skin of the rectum, but you went into the sphincter, which is the
Yes.
part that, allows us to, if you want to hold back gas, let's say, right? We're using our sphincter muscles to do that. So you tore into the sphincter.
Correct. Which that has been grand fun to heal from. No one talks about that. Um, and shout out to all pelvic floor PTs because they are amazing.
Mm-hmm.
Um, so the person who delivered my baby and did the stitching afterwards was a resident, even though in my planning for this beautiful birth and my birth plan, I did specifically say no residents, but in the moment, I didn't care. Um, she was great. And I don't know that if it had been somebody different, that I would have had a different outcome. I don't know. But what happened was with the healing, I did have a lot of granulation tissue. So anytime I would sit, breathe, stand, walk, pee, poo, anything, it hurt for weeks. And I knew something wasn't quite right. And I did virtual appointments with the OBs, and they were like, "Oh, it's just healing." Like, no. And I think Tanya was actually, I think you were probably the one who said, like, something's not right. You really need to make an appointment. So I
Yeah.
did go in.
let me chime in real quick because I want to make sure our listeners know what granulation tissue is. That's going to be a term most people haven't heard. Granulation tissue is tissue that is still healing, which is kind of a fair way of describing it, but it's tissue that isn't really meant to be on the top layer or touched, right? Like it's tissue that kind of usually ends up inside the healing laceration and not sort of on top. So it feels really raw. It has raw appearance and a raw feeling. So it looks more like mucosa. And when I say mucosa, what I mean is the tissues that we have in our body that are moist and wet, like our tongue, inside of our mouth, the insides of our vagina. It shouldn't be in places that are otherwise dry. And there are some strategies that we use to help people minimize this granulation tissue. And so that's what you were going back for, right?
Yes. Yeah, absolutely. So, it's very sensitive. Like you said, it's raw. It feels almost like and it looks like a large skin tag, basically. And it's in an area that's pretty hard to visualize, and I'm flexible. But so I knew something wasn't quite right. So I made an appointment with the OBs, and again, every time, this is in still the early months of the pandemic, I'm going into a hospital. I have a newborn at home. I have disabled and immunocompromised in-laws. So anytime I had to make a decision where I had to see a healthcare provider in any capacity felt like a risk. And that was also hard to swallow. So I did go in and they did something called silver nitrate, which you can probably explain better than I can, but basically they burn it off, and it does not feel good. And it does not feel good for several days. So I had to go back 3 or 4 times. And each time I saw a different provider, and each one had a little bit different technique, for better or worse. I don't know if that ended up being good or bad. But finally, it did heal. And so now this is 9 weeks in. I've been dealing with this 9 weeks. This pain in that area, and 3 or 4 appointments with this silver nitrate. So that it wasn't fun.
No. So when did you make it to the pelvic floor PT? Tell us a little bit about that. We won't go into crazy detail, but
yeah. So the one thing I do want to comment on, and it kind of goes along the same theme of advocating for yourself. I asked the main OB that I did see multiple times. I asked her of her opinion on pelvic floor PT, and I said, "Hey, do you have any recommendations within this university system?" And she said almost verbatim, "Oh, hardly anyone needs that. I don't have anyone to recommend. You won't need it." She was wrong, very deeply wrong. And I think it's just another example of how women especially are really not given the best access to the tools and the service and the education that they need. It could have been just as easy for her to say, "Yeah, here's a recommendation," or "I don't have any recommendations. Google it." But instead she said, "No, you don't need it." Luckily, I had Tanya, I had the internet, I had my own experience working with physical therapists in the hospital. So I went ahead and made an appointment with pelvic floor PT. It was a 4-month wait. It took a long time to go see that, to get into them. I ended up going with a different practice who could get me in a little bit earlier, but I had to drive over an hour to get there. And they were amazing. But I did have a lot of trouble for the first 6-7 months of bowel urgency, where I get the feeling that I have to have a bowel movement. I got to go now. There were a handful of accidents. Nobody talks about that after birth. You hear a lot about, moms sneezing when they pee. You don't really hear about that you can't leave your house or go for a long walk or go very far from a bathroom, because when you need it, you're going to need it. And if you're not near a toilet, well, you're out of luck. So that was not fun. And the couple moms, more than a handful of moms that I've talked to about this since, I don't know, it doesn't seem like it's that uncommon, but a lot of people didn't have the same experience, even despite tearing. So I don't know.
Yeah, there's a lot of variability from person to person. I will say also that I've taken care of a lot of moms who do really well after their first baby, but there's a big shift in what they feel after their second baby. And it's often confusing for them because first babies were more likely to tear than with second babies. So someone will have their second baby, they won't tear, they think jackpot, everything's great, and then after, sometime after 6 weeks when they're really trying to get back into the swing of things, they're like, what is going on? I feel all this pressure, I'm leaking, all these other things going on. So the range of normal is huge, but we know that carrying a pregnancy to near term or term is enough to increase the rates of all of these things, namely pelvic organ prolapse and stress urinary incontinence. Having a vaginal birth skyrockets those rates, and then we get into some of the other concerns that can arise related to tearing. So you got the trifecta. It's really something here.
Yeah.
Aye.
It was, but I had a great pelvic floor PT. She was truly wonderful. I worked with her for probably 3 months, and was very diligent about doing all the exercises on my own, doing the internal scar massage. And that really, really helped and gave me freedom, because until that point, so really for the first 6 months, I literally could not go very far from my house. Like I had to be somewhere where I could use a toilet. Now we have a camper van, and that's been great. So it's given us some freedom. And I will say that every single time we take that camper van out, I have used our little compost toilet, and it's been wonderful, because that has also given us freedom. But that was definitely a part of the healing, that even though I had learned about tears, even though I had learned and heard about urinary incontinence, I did not expect bowel incontinence. That was a new one for me. And I really had to put my shame, I guess, aside and answer questions from my pelvic floor PT very honestly, and things that we don't typically talk about. Like, would you like me to give an example?
Oh, please do.
Okay, we'll get down and dirty. So like, when you have a bowel movement, you should, be able to wipe yourself once, twice, maybe 3 times, be pretty clean. If you're constantly wiping and can't get clean, what is that actually a signal of? What is wrong? And how do we fix it? So answering questions like that, like, are you passing gas without control? Are you wiping and not getting clean? And questions like that feel very personal and somewhat embarrassing. I really had to put that to the side to get the right help. And like I said, the therapist I worked with was amazing. And she knew how to ask those questions. She knew how to navigate that too, to kind of hold my hand through it and get me the right treatment to move past that. I will say 19 months later, it's still not perfect, but it's a long way from where it was those first 6 months.
And what has the journey returning to sex been like for you?
Challenging. Yeah. I think that's less the physical aspect, and more the mental postpartum depression bit. That's been a much larger player in that field than the physical bit. But I did need to physically, it helped me, and the pelvic floor PT kind of coached me through this, doing that internal scar massage ahead of time, lots and lots of lube, the right kind of lube. She gave a lot of recommendations to really help that be a physically comfortable and eventually pleasurable experience.
Right. Great. Pelvic floor PTs are amazing. We all need them, and we shouldn't only have them when we've had a hard time. Everybody needs them. Okay, so since you just mentioned the PPD, I want to ask you first, actually, which came first, trying to sleep train Silas or the PPD?
The PPD,
Okay,
I
so
think.
let's talk a little
Yeah.
bit about that, because that's where the whole story comes a little bit full circle back to Liesel, right?
Yes.
Okay, tell me more
So
about that.
in November, after I felt like, okay, we've gotten over the road bumps, like we're doing better. Um, Silas's physical development was a little slow. That was a source of stress. I realized that he didn't just spit up a lot. Turns out he actually had pretty gnarly reflux. He ended up on medication for it. I had really, and I still do, had mommy wrist, which I can't pronounce the actual diagnosis. It's like de Quervain stenosis or something along those lines. But what that means is my wrists and my thumbs hurt. So this is all in November. So my mommy wrist had just, oh my gosh, I could barely pick up Silas. And in fact, one day I didn't exactly drop him, but like from an inch above the floor, my wrist gave out. So I finally got treatment for that. What else was going on in November? Separation anxiety started really creeping up for him as he was kind of turning 6 months old. That was starting to come about. So he stopped sleeping. I was so angry. I felt like we had gotten through the tongue tie nightmare. Things were going okay. Silas had started to sleep a little bit more. But then all of these things really kind of stormed up, and it felt like a tornado went through the house. Along with his reflux, the gastroenterologist who diagnosed that also diagnosed him with a cow's milk protein allergy, which, small tangent, I don't actually think he had. I think it was related to the tongue tie and my oversupply and all that, but doesn't matter. At the time, I was desperate for any relief for him. So that meant I went dairy-free, egg-free, soy-free, gluten-free. So on top of everything, now I have to modify everything I eat, which I did. And it was kind of hard. Not really. It wasn't really hard. It was just I really miss cheese. But, and soy is in everything. But there are a lot of really good dairy alternatives these days. So it wasn't too hard. But going through an elimination diet, all this stuff happened in November, and I was just pissed all the time. I was so irritable. It was worse. It was 1,000 times worse than the worst PMS of my life, all the time. So going back to what I meant about social media and Instagram being a double-edged sword, I was seeing a lot on social media and on Instagram in particular about mom rage and anger and irritability and how all of this is normal. And on one hand, it was validating to read that. Like, okay, I'm not crazy. This is normal. The world is topsy-turvy. It's normal to have this, my hormones are still crazy. I'm still breastfeeding, all these things. So it was good to have that validation, but ultimately, I actually think that it delayed my diagnosis and treatment, because what I was going through was not normal. And I ultimately did not get treatment until 6 months later, towards the end of May. In November, at that same time as I'm experiencing all of this, I did reach out to a counselor that I had worked with once before. She again normalized my feelings, validated them, but kind of left it at that. She basically, at the end of the session, said, if you want to meet again, I'm here for you, but I think you're going to be okay. And I was not okay. So that went on pretty much like that for another 7 months, 6, 7 months, which was really, really hard. And part of, I've mentioned that I'm in therapy several times. I do therapy weekly. And a big part of what we talk about is processing and grieving that first year. Because it is not how I wanted it to go. It's not how I had this image in my mind and this plan in my head of what the first year with a newborn was going to be like. And I didn't expect it to be all rosy. I thought I had realistic expectations, but it still was not great. So we did do, so sleep is kind of tied into this. So this is now November, December, January timeframe. Silas basically stopped sleeping in his bassinet, stopped sleeping in his crib. Anytime I thought about leaving the room, he cried hysterically. And even though I read that, separation anxiety is normal at this stage, it was really hard to live in that and to not be able to leave the room, not be able to go to the bathroom, not be able to sleep. That was hard. So we did end up, I learned about how to safely bed share. And that's a whole can of worms that I'm happy to talk about, which we did do that for a couple months, but it still wasn't great. I still really needed more sleep. All of our friends sleep trained. They essentially did cry it out sleep training, which never felt right to me. But at this point, I have raging postpartum depression that's undiagnosed. We still have no support. I'm so tired. I'm so exhausted. I'm desperate for just a stretch of sleep. And I'm desperate to sleep without something clinging to my boobs. So we did try doing a sleep training program, which it was, in air quotes, successful, right? Silas did end up sleeping in his crib by himself for long stretches. This was around March, April timeframe. I was getting more sleep. So everybody was sleeping more, right? I thought that was going to be the magic pill that everybody's getting more sleep. Silas is going to be happier. I'm going to be happier. Jeff's going to be happier. What ended up happening was Silas lost 10 percentile points on his growth curve because he was no longer nursing at night. He was eating solids at this point, but he was still breastfeeding during the day, but he was going these really long stretches without eating from our sleep training program. And what I've learned since is that's really not okay. Maybe it's okay for some babies, but it was not okay for my baby. So he's already a tiny guy. So he went from the ranging from the 10 to 14th percentile down to the 1st to 4th percentile, which was a big drop, and definitely something that was very scary to go through. On top of that, so he didn't necessarily lose weight, but he lost his growth. My anger didn't go away. I was still angry all the time. I was still overwhelmed all the time. I was still crying every day. Sleep training, which felt wrong to me from day one, but felt like the only answer when we were desperate, and all our friends did it, and it promised these long stretches of sleep and all their kids are fine. It didn't fix the problems at all. So now we add an extra little cream or butter to everything Silas eats. I finally listened to, so what happened was to get the PPD diagnosis. So this is now in May, and I'm a disaster. Thinking about what to cook for dinner was so overwhelming. I couldn't handle it. I was mad at the world. I was mad at Jeff. I never felt angry towards Silas. I always felt joy and love towards him. And I just figured, okay, well, this is a year into pandemic parenting. Like, isn't everybody upset? But it was more than that for me. And I kind of recognized that it was more. And I can't remember which came first. Liesl posted a post on her Mommy Labor Nurse Instagram account that was about her starting an antidepressant for postpartum anxiety. And it resonated with me. And her posts about it and her sharing about it, man, maybe this could this be it? Could it be postpartum anxiety? Because I don't really feel like I fit the mold of postpartum depression. Since learning more about it, and it was raging postpartum depression. So I read her post. She did a podcast. She has a podcast, and Tanya, you were on as a guest, and she talked about her experience. And this midway through the podcast, I'm texting you. I'm like, Tanya, how do I get help? Like, everything you're saying, everything Liesl's saying, like, you is just resonating with me. I'm in a really bad place. And you sent me to Postpartum Depression International, I think.
Postpartum Support International, which the web address is simple, postpartum.net for anyone in need.
Thank you. And through that, I located a therapist. I clicked with the first one I worked with. At first, I did not want to try medication. I was like, well, I'm still breastfeeding. I know the research is out there is good. But if I can, I want to do this without using medication. 3 weeks go by, and I'm doing therapy once a week, maybe twice a week at that point, actually. Basically the dam broke, and I had a session with my therapist, and I was just like, I cannot function. Made an appointment with my primary care provider, was diagnosed with postpartum depression, and started an antidepressant. On Silas's first birthday was the first dose that I took. Within 5 days, oh my God, I was me again. I took a picture of, I was in the kitchen, and I had a bowl of food for Silas's lunch in like a little pottery bowl that I had made. I make pottery, and it was one of my favorite bowls, and I dropped it, and the food went all over the floor, and my bowl broke. The week before, that would have made me melt down. I would have just not been able to cope. But after being on medication for only 5 days, it's like, whatever. That's a bummer. I'm bummed my bowl broke, but like, whatever. Silas will get you something else to eat. And experience it. So I took a picture of it because it was such a turning point for me to have a normal reaction to something that would have sent me into a tailspin only a week before. So it's been a journey.
Wow.
So I've learned a lot about postpartum depression since then. I still am with my same therapist, and I just adore her and cannot recommend her enough. She has really helped me navigate, like I've mentioned, grieving that first year, and brought meaning to that phrase, give yourself grace, and not feeling guilty or ashamed of maybe some of the ways that I felt, or the things that I said, or the things that I did, because I was doing the best that I could. And to not only forgive that, but applaud that. And that's been come a long way since June. So it's been a journey. It truly has. And I'm still on antidepressants and plan to be at least through the end of breastfeeding, whenever that is. And then I'll make a plan and figure out, how to navigate that. But for now, it is a tool that I use that is amazing. It's not the only tool that I use. but it's one that has made me able to function in order to heal everything else, in order to even just begin to heal. So I'm a big advocate for that. And I wish that I had gotten help, 6-7 months earlier. I think a lot of, can't go back and fix it now, but I really try to advocate to moms, especially, that just because you're out of your 4th trimester doesn't mean that postpartum depression or postpartum anxiety can't creep up. And if you feel like something is wrong, trust yourself, trust your gut, reach out to anyone, even if it's just your friend or your mom or your sister, brother, whatever. Start that conversation, because once that ball starts rolling and you start getting the support in any way, even the smallest little bit of support feels like the world. I had 2 friends who reached out to me every single day as I was going through this. And they wouldn't let me say, yeah, I'm good, because they knew I wasn't. And it meant the world. And it truly was a lifesaver. And, just, you might not have full-blown postpartum depression or postpartum anxiety, but you can still be struggling and can still get help for that. It exists.
Yeah.
So it's been a road, but
Your story, it's so funny. So many people's stories come together at a moment in time for me where I made a big change to the program and the way that I care for people, because the same, I recorded that episode with Liesel and learned that Liesel started experiencing postpartum depression after we wrapped up. And then that episode aired a few weeks later, and you and at least a few others out of the blue sent me a couple text messages when the episode aired, and my light bulb started going off that as much as I think my program has helped people get through the 4th trimester, we can't just turn it off then. Here I thought as a midwife I was doing such a grand job, not just doing a 6-week visit, but offering care consistently through the 4th trimester. And then I had to have my big slap yourself on the forehead aha moment of it's not over just because they finished their 4th trimester, dummy, right? And that's when I changed the program to a monthly subscription model, because I don't want to be in charge of wrapping it up. I remember our last visit, and I remember having a hard time hanging up that call because you weren't done with me and I wasn't done with you, and it wasn't fair or right, and I didn't know what to do about it then.
I don't think I recognized it at the time. I remember feeling like I'm not quite ready to not have Tanya. But it was the end of the program. It was my, 4 months had gone by. I was doing better.
Yeah.
But I also vividly remember that phone call and feeling like, okay, I know Tanya's just a phone call or text away, but I'm not quite ready.
Yeah. And the people since who have struggled, they just stay.
I do want to say, just because to tie up the loose end with the sleep training stuff, what I have, because it's not just about sleep training, it's really the pressure that is put on families from our culture. And maybe that means independent sleep. Maybe that means, not being a picky eater and eating 3 full meals a day, whatever it is, being able to label their feelings, whatever it is that we're feeling pressure on. I think trying to turn that valve off. Sleep is a good example that I can use, because the solution that we found for us was not sleep training. It was not full-time bed sharing. It was kind of somewhere in between. And I will say that living on that spectrum and knowing that it is a spectrum and it is not a static linear thing, it shifts and changes, has made sleep in our household something that I really love and cherish. Not going to sleep. I mean the bedtime snuggles, the nursing to sleep, the occasional long stretches where I get to sleep all night by myself. It's wonderful. But I also really love the 5 a.m. mama and I go in and we snuggle until 7. So really embracing the spectrum of it, and the non-linear and the non-black and white nature of sleep has really shifted my perspective of it and my understanding of it, and made it something that's no longer a source of stress. And it's no longer a source of, what am I doing wrong? Why won't my 2-month-old sleep through the night? My friend's 2-month-old is sleeping 8 hours straight. Man, I would love 8 hours. Getting rid of that has been it's turned it into a really beautiful relationship. And that goes for both me and my son and my husband, and how he can be involved in it, and creating really healthy sleep habits, not necessarily just crying it out in the crib.
Yeah.
So that's my soapbox on that one.
You know what? I think it's so important for people to hear. I'm on the fence whether our listeners that are pregnant, but more importantly, those in the thick of it in the early postpartum period. And when I say early in this context, I mean you're still in the 4th trimester. I don't know how much people can hear and take in and maybe make a substantive change. I'd love to hear from people if this conversation actually does help you put things in perspective. But the reality is, perspective takes time. I'm 21 years postpartum, and every single one of these conversations brings something up for me that's very real.
Yeah, absolutely. Perspective takes time. That was the theme of my therapy session last week. In a good way of like being able to look back on that year and reflect and have that perspective. And I'm only 1 year out. Mm-hmm. And I'm sure when I'm 21 years out, I'll probably still be reflecting.
Erin, I wish I could throw my arms around you and give you the biggest hug. I am so honored that you would take this time to share a very detailed and deep and long story with me and our listeners. And I value what you shared with us. I hope our listeners do. And, you know, I know we won't talk every day, but please stay in touch and keep me posted on things. I'm so grateful to you.
Absolutely. And, you know, there's a lot of joy when I think back on that first year, and now there's so much joy in my life. And a big part of that is working with you and all the contacts and conversations we've had, and even just the random text messages. So it's been wonderful to talk with you again.
Thank you so much. Stay in touch.
Okay, sounds good.
Hey everyone, it's me, Tanya, your host here at the Mother Wit podcast. You know I sometimes invite my clients on the show to talk about their birth stories and postpartum experiences, but I want to tell you a little bit more about what those clients and I actually do together. I started Mother Wit to help people in the perinatal period achieve their health and wellness goals. That means whether you're hoping to conceive and struggling with high blood pressure or high blood sugar, or you're having trouble managing anxiety or depression in the postpartum period, or maybe you just need support and advocacy between prenatal or postpartum visits, I can help. Get a discount on your first consultation with me at motherwitmaternity.com using the code FIRSTCONSULT 10% off. That's 10% symbol, all one word. I'm looking forward to working with you and maybe having you on the show too.